Hi there.
Hello, I'm Dr. Vic, owner of Apollo Physical Therapy Centers. Started the center about 17 years ago, and it was through my own process or experience as a kid that led me to chiropractic. I mean, to begin with, I had a whole slew of health issues as a child, and even before that, we have Alex being my patient, and she is pregnant. She's 20 months pregnant.
28 weeks.
Or 20, sorry, 20 weeks pregnant. And so we're going to do an analysis today, or an assessment of the pelvis, to make sure that it is in proper alignment. And with that proper alignment of the pelvis, allows for the greater ease of delivery of the child during birth. So it's important, and for those of you that don't know, the pelvis can actually shift. It can move from side to side, and that can be from many different factors, whether it's a dominance on one side, being dominant right-handed or left-handed, increasing strength in that regard. So one side can become strong, one side can become weak, or through different traumas that you've experienced throughout, whether it's impact from a car accident, or if it's through, in fact, trauma through impact sports, like contact hockey, football, rugby, you name it. And then added to that, if you're doing a unilateral sport, meaning that you are dominant on one side or over another, like golf, hockey, baseball, basketball even, shooting on one side, swinging on one side, it creates imbalances throughout, and we don't generally feel them in our youth. I mean, I'm still 20, Yeah. But we don't feel it in our youth, and it's only later on, like 30, 35, 40, we really start to see the impact of those imbalances. So what we're here today is to see where those imbalances are with Alex, and to make sure that we sort all of that out, make sure it's in a correct position, so that not only for her pregnancy, but for day-to-day ease, that her body is in a neutral position, her nervous system also is uninterrupted in that sense, and it is so when the body is in its neutral form.
Cool, thanks. Okay, so can you explain a bit what really can cause a dysfunction, or we can say a subluxation of a vertebra over the spine in not only in pregnant women, but in most of the people,
in
actually,
most people?
in humans.
Yes.
Even in animals.
This is very true. I mean, I would have to say more in domesticated animals, more so, because there's more problems there than animals being in nature.
True.
As nature has its positive effects on any living being.
The grounding effect.
It has a tremendous amount of a grounding effect, which allows for the body to come back to its neutral form. However, living in today's age of sitting, not being active, a lot of dysfunction happens, as well as from the impacts of the traumas that we talked about before. Those were just the physical impacts. Then we have our mental emotional impact that also has an influence on our physical and physiology of our body, and actually neurology of our body, and how our body actually functions. So just to sum up how the nervous system works in just a simple form, we have our brain, then we have a connector portion, which is the midbrain, and then we have our spinal cord, which then exits from the base of the skull down to this area here.
We can see on the board right here.
Yes.
Yeah, good. So
right from here to here would be our spinal cord, above here would be our midbrain, and then our brain. And so what and how it functions is that, just to sum it up, there's two pathways of information that exist. There's efferent information, which is information that is exiting, E for exit, exiting the brain to the body in terms of its functions. And then we have afferent information, which is sensory information that is coming back to our brain. And in order for our nervous system to function to its optimum, it's a closed loop system. One feeds the other. But now when we have a break in the system, say for example sensory information coming in from our vestibular system or our balance center, or our eyes, or our feet, then this system is going to be disrupted, and our body is going to want to adapt itself based on the information that is coming in. So if that information to begin with is off, well, then our body is going to have to adapt to that missed out information to make our structure and function the best it can be in that current state. So it's very important that we bring back and restore that information that is incorrect in our body so that our body can function to its optimum. I mean, we're meant to live to say 125. And in this current age and day, we're living 75 to 78 to maybe 80 as an average of a life expectancy. And that too, being on, I guess, 65 or older, you're on a cocktail of 8 medications. So really, are we living longer or are we just sustaining our life?
Exactly.
Our goal here is to actually optimize the body's function so that we can live long and healthy. For every one of our patients that comes into this clinic, we want them to live to 100 plus. I know everyone listening right now is like, I don't know if I want to live that long. Because most people's mindset and idea of that age is that you are crippled or you're in a wheelchair or you're in a walker, you have dementia. But that is not what I'm talking about. It's about optimizing life, optimizing health, so that when you're at that age, you still have your wits about you and you can still move and be functional. So that is our goal here, is to allow for each patient to be in that state as they age. When we're younger, we take our life and our movement and our day-to-day activities for granted, but it's later on that we're looking at in making sure that we're in our healthiest state so we can be happy and healthy.
Wow, thank you for that great speech. You sound like a guy that took a lesson with Institute Neuro Performance.
Well, I've been corrected.
Yeah, nice. Okay, let's go with Alex.
Okay, so how has your pregnancy been going so far? I know it's not 20 months, sorry, I said that earlier, it was 20 weeks, but how have things been going? How was your first 3 months?
I had nausea, but that's all.
Okay, and then how has your body been feeling overall? How has your energy been?
My energy is starting to be better.
Okay. Was it reduced at the first 3 months or so, 4 months?
Yeah, I was tired.
Okay, all right,
all
and
the
now
time.
your energy is...
It's okay.
Yeah.
Yeah.
Okay, awesome. And you have that awesome glow about you. You're full of energy.
Yeah.
And overall in your body, have you noticed changes? Obviously, you're noticing changes of your body, but are you feeling something that's different?
Not really. Maybe this week I had pain in my lower back and upper back. Like,
okay, can you show me whereabouts?
Like here.
In there? Okay.
And maybe here.
And on the right
But
side?
I know it's because we are sitting all day since like 3 weeks.
Okay.
We didn't go to the gym or so it affected me a lot.
Okay, are you right or left-handed?
Right.
Right-handed. Okay. One thing you should know about pregnancy is that oftentimes pain and discomfort can come about, and what we don't know is that likely your body was dysfunctional prior to being pregnant, but because of these changes in movement, it's heightened your level of awareness of what's happening in your body. Okay, and so what I'm going to go through today is seeing, okay, what is that alignment of your pelvis, how the muscles have adapted, and then I am going to put a little bit of a force through your body, as gentle as I can be, in order to restore that movement and that mechanical movement of your joints.
Okay.
And in doing so, this is a reset to the nervous system and allowing for that sensory input to then know where its body positioning is in space. Okay, and that is essentially what our nervous system is trying to do on a regular basis, is to see where our body is in space. Okay, I believe we're meant to be on all fours. And if we were on all fours, our body would be symmetrical and it would balance itself. However, because human beings are now upright on 2 feet, the body doesn't get that reset opportunity, especially in the pelvis, to reset once it gets into the pattern of dysfunction. So in a quadruped position, hips would reset, knees would be balanced, head would be upright in more of an extension position, having a stronger middle back, which is oftentimes an area that is weak, allowing for more room in the jaw to move with extension of the head. And as well, our glutes, our butt muscles would be strong. I mean, you see everyone nowadays in the CrossFit gyms, you know, it's all about the ass. It's all about the buttocks, you know, and having strong buttocks. But I mean, in that position, I believe that it would be, we would be in a much better state. Not that I'm about to go walk around on all fours now, but I believe that's kind of what we're intended to be. So now in knowing that, we can strengthen accordingly. So in relation to pregnancy, and I've spoken to many doulas about this in terms of the position of birth of your child when you're delivering, and women have found it to be easier to deliver babies on all fours rather than being on the back. And allowing for gravity actually to allow for the baby to come out, in helping in that regard, and putting the pelvis in that position.
Okay, you talk about the quadruped movement is pretty nice, since the scapular motion is way better too in that position than in the walk.
Yes.
And as well, when you see the structure of the feet and the lower of the body, it's like an invert pendulum, they said. The feet are so tiny compared to the structure over it. It's not made for a proper sustainability, we can say.
Right.
So that's interesting. So we need to spend more time doing sports, at least, or activities that count, that you get to go on the ground. And the ground, it feels shakier as well.
Yes.
You can fall on the ground if you're already on the ground. So there's a really nice exercise we can do over it.
Also, to add to that, I mean, what kind of strengthened this theory was the fact that, I mean, it's not so much grounding of the feet, but the fact that I went to Barbados on a guy's trip, and we went for a surfing trip. And I'm looking around and I'm like, wow, why are all surfers like jacked? They're all fit, lean, and balanced. You know, and it's because of the fact that most of surfing is actually on your tummy on the board paddling, and you're in that form of quadruped, right? And then when you jump up and balance, you're now your core is engaged, and it's all core activity. Yep. Now, being in an upright position, we don't get our core is not, and our abdominals are not engaged. Like they would be in a quadruped form, where our core would always be engaged, and in rotation of the spine, in the contralateral movements,
exactly.
Right, in the sequence of patterning of that gait in a quadruped form, we would be strong here. But because we're in an upright position, this gets disengaged, and especially sitting all day, we don't get that engagement here. You look at swimmers as well. Both these movements, surfing and swimming, they're equal, both sides, arms and legs, and it allows for that balance of the body.
That's a contralateral activities as well as instability activity.
Yes.
And full body as well in the crunch position, a bit, you can say squatted position. And people don't realize how much inner ear and cerebellum are used in those kind of activities. And those are the ones that recruit most of our extension chain, that prevent us from falling, and they recruit the more biggest muscle of the body. So I recommend those kind of exercise. So that's a good point here.
Well, it's interesting now you mentioned that. Going into swimming, after I came back from that event, I started swimming hardcore, 5 days a week, 20 to 30 laps a day, and I screwed myself up. I created a chronic pain in my neck because I have an inner ear imbalance, right? So I'd be interested to see, after what Nick has done with me in terms of improving my vestibular system, and as well rotation of my neck and working on my jaw. I'd like to go back now. I mean, I'm hesitant to go back into the pool because of what I went through, but I'm equally as much interested to see now going back into the pool, seeing if I can keep my lane straight, because I used to sway, and to see if I can continue to have that balance from left to right in terms of my breathing and my stroke, to see how I maintain the line and balance in the stroke.
We find something about your asymmetrical neck reflex. Now you do understand. You practice at home, so it will be good. Because otherwise you were fighting against a reflex, and those got to be integrate on the crawling actually, and all the quadruped. all those guys are here from something. So you were basically, when you were in the pool, you were crawling. So using that reflex that was not properly integrated, and finally you get the bad muscle contraction, bad sequence of movement, and
real bad
sports are
pain.
good, but the reflex need to be integrated for everyone. So let's help a future baby here while fixing the mummies, and after we gotta work on the reflex later on. Yeah.
To help the future.
Yeah, exactly. Okay.
All right. So I'll just start off by just talking a little bit about this table. I mean, this table has many different functions. It actually is a traction table, but a great thing about this table is it has a drop piece which can assist in helping adjust and reset the pelvis without putting too much force, because the table does a lot of the work. It has resistance, and I can set the resistance so it resists, and then it drops. So then that impact actually allows for the resetting of the pelvis without putting as much force. Another great thing is that this table has a thoracic drop piece, or a piece that drops down for pregnancy for women as their stomach gets larger as the baby's growing. So allow for that clearance there, so that we're not putting too much pressure on the stomach itself and on the baby. So Alexa, I'm going to have you lie down on your stomach for me, please.
Kind of frightened. You talk about this is a traction table. I hope there's no place for 4 horses to create them.
No.
Good old medieval table.
No. Well, I mean, some patients have called it the rack.
Yeah.
You know, because we have to strap in the feet and spread it out. But no, this is for health reasons and for only positive reasons.
Okay, perfect.
Alexa, I didn't ask you earlier, but have you been? How has your digestion been?
Good.
It's okay. It hasn't been affected at all, and overall, even before pregnancy, digestion was okay.
Yeah.
Okay. Prior to pregnancy, your menstrual cycle was okay.
Get some issues just before, I think.
I had the issue with.
Just before?
Yeah.
Was it like more of a heavy
no,
flow,
it was,
or
delayed?
Delayed.
It was delayed,
it
almost
was
2
delayed.
months.
Yeah.
Oh wow! So it's not regular.
For the first time of my life, like the.
This was before pregnancy.
Like the 4 months before.
Okay.
I had 2 delay.
Yeah.
I think.
2
So
delays.
we were thinking she was pregnant earlier, and finally not, and finally the second time after we said,
Then it
it happened last time, it was good, but not. It was a baby this time.
But we the same time we were in Europe.
In Europe.
Okay. Did you have increased stress?
Maybe.
Okay. Maybe not.
Yeah,
because I mean, stress.
Sometimes just the flights are creating imbalance in the system. Huh? That's a massive player. We don't talk about.
That messes up the body and the nervous system. Okay, and no pain aside from now, just slightly on the right side.
Yeah.
Okay. All right. Any specific injuries that you may have had earlier on? Any falls before the pregnancy?
No, I don't think.
Okay. All right. Well, let's have a look here. I'm just going to assess the alignment. As the legs are attached to the hip, we can assess the heel length here. to see that on the right side the heel is longer than the left side. Okay, and so then we come up here just to assess side joints, and you can see that it presents the same way. Now I'm gonna
exactly. So the right side is gonna seem lower since the
Yes.
leg seems longer.
Yes.
So it's getting tracked, in fact, by the hip.
Correct. And so I'm going to put a counter force on your back. So we have a bone in our pelvis called the ischial tuberosity. That's actually what we sit on. That's the bottom part of the pelvis. And so I'm going to put some pressure on there to bring this side down. And I'm going to put some pressure on that PSIS, posterior superior iliac crest, on the opposite side, just to put a little bit of counterbalance or opposite force from what it's used to. Are you okay there, Alex?
Yeah.
So it's always a good question. Which side is lower and which side is upper, actually? Because if we say a lower side, is that the lower side, or the opposite is the upper side?
It's the opposite. Good question. Okay,
You know
were you
your
okay
stuff,
with
guys,
that
anyway.
pressure?
Yeah.
So you're
So-
fainting a correction, so we can see if there's an adjustment, a musculoskeletal adjustment. Actually.
Yes,
And
in
we can
fact,
see it's way better.
that the heels are more in alignment and almost in alignment now with just that level of counter force. Now, as Alex goes upright again and walking around, that will likely just go back. So that's where we have to put in a little bit of a force, a chiropractic adjustment, in order to realign the pelvis to bring it back to its neutral place. Now our pelvis, I feel like, is our foundation. And if that is off, what is above, like the lumbar spine and the thoracic spine can respond to that. And then equally as much our arm movements can respond to that. So, I mean, as that old song goes, you know, the knee bone is connected to the hip bone and so on and so forth. Everything in our body is connected. We're not just the sum of our parts. We can't just take an arm out and put it back in like a G.I. Joe or a Barbie doll, right? It's how it works together. And that's how we look at the body, is how the whole body is functioning. If a knee pain is occurring or back pain is occurring, doesn't necessarily mean that the dysfunction is necessarily there. It can be above or below that area, so it's important to take the whole body into account. That's why our tagline at Apollo is transforming lives through whole patient care. It's not just a pain-based system where pain is, that's where the problem is. That's not necessarily true, but pain is an indication that something is wrong, so we shouldn't be just taking medications or painkillers to remove that. We should actually, in fact, figure out where the root cause of that problem is and causing that pain wherever it is in that body, fix the dysfunction, get to the root cause of the problem so we can actually restore that function of the body.
Yeah.
Neurologically and functionally. Okay.
So the hip move, since there's an imbalance somewhere, so the brain find a solution for the moment, a musculoskeletal solution by switching here the hip, but it might come from the eyes, from the plantar sole, it may come from a different sensory stimulus that create at the moment a bad musculoskeletal solution.
100%.
Yeah.
It's causing a false sense of balance.
Yeah, exactly.
Where physically, obviously, we can see that there is imbalance, but to the brain itself, it's in a state of balance. But it's because the sensory information that's coming back is not proper.
Exactly.
Right? It's like, I was just watching Mandalorian yesterday on Disney Plus, and, there's a lot of robots, right? Or droids in that show or that series. Like Star Wars, and it's interesting that a bunch of them got injured and they're trying to reset. And that's essentially what our body is doing on a regular
Yeah.
basis, is taking that sensory input, readjusting, and trying to find that balance where it can't find balance. And oftentimes if it's in that state and there's too much of this in the body, then the nervous system really starts to shut down in terms of what it can do, and then getting to a point of smaller movements, because that is essentially what it feels comfortable with, and not having these grand
Protection
movements.
mechanisms. Yeah, exactly. So that's why you see sometimes old people that have difficulty to move, or people injure and injure and injure. The problematic is people don't get treated since they say, oh, if I don't have much pain, it's going to fix it by itself. But once there's a mechanism installed like her at the moment, there's one other mechanism that can go over it. So after they want a special treatment that fix everything in one shot, no, you work like layers. So the problem
It's a training process.
Exactly. We got to remove all those layers after to put it back in place. But once you're in place, will you eat healthy? Will you think healthy? Will you do some sports activities, rehabs and stuff to make sure you don't come up? But anyways,
well, healing and
bad herbs will always come in the field.
It's a challenge in getting yourself to a health and maintaining it. It requires work.
Yeah.
But at the end of the day, I hope we are worth it at the end of the day to put that time and effort in self so that we can get the result out of it in the future, right? It's an investment, and that is what we're doing here.
Also-
Alex, I'm gonna have you just shift down for me a little bit towards your feet. Yes, just right there. Is that a little bit further down for me so that you're more on the cushion? Yeah, is that okay for you?
Yeah,
Okay, are you comfortable?
I have a bit of pain in my belly.
In your back? Okay.
My
Belly.
belly.
Okay, I'm gonna just bring this up a little bit. Is that better?
Yeah.
She's not that big yet.
More support. Yeah, you're 20 weeks along, so you can see that there is a rotation here into the upper lumbar and into the thoracics as well. Where there's limited left rotation of the thoracic spine, and that is because of the fact that the body is adjusting to the structure of the pelvis.
You can see the
So-
rotation as well of the hips at the moment, like when
Yes.
she's lying like that. Yeah.
Where the right side is not sitting as flat
yeah, exactly.
on the table, right? So what I'm going to do, Alex, is gradually increase the pressure of this table or the resistance of it. So I'm going to have you take a deep breath in and out. Okay, you see there wasn't enough resistance in the table, so it fell. And I'll gradually increase it. Take a deep breath in and out.
There we go.
Are you okay
Oh,
there?
it's called a
Yeah.
drop in chiropractic, right?
This is a drop table, yes. So I'm increasing the resistance of the piece underneath, and as I put some pressure into it, then it'll hold and then it'll give way, assisting me in adjusting the pelvis.
Perfect.
So you can see even just after one drop now, we have more of a neutral
Nice.
space in the spine.
So
And-
you can see there's less rotation as well in my side here.
And then the heels are actually
Seems good. Seems good.
neutral. And that was just one drop. I generally do 3 to 4 and in resetting that mechanism. So deep breath in and out.
I can add. We get to think as the body as a whole. So if there's a rotation of the trunk, it's going to pull the tissues. That's going to affect the leg's length as well. So it's not done yet.
Yeah, it's
So we got to make sure that
One more
when the
time.
people's left the office, they're straight at least. At least lying, but stand. We need to fix all the rotation here. Those guys at Apollo have been trained in neurotherapy with me, so they can fix the posture upright as well. So that's a good way, because people are not in big pain lying most of the time. They're in pain where they're working seated or standing.
deep
So
breath in.
we need to check everything
and
around.
out.
That's a beautiful adjustment here. Wow.
Deep breath in.
This guy's a pro.
And,
Beautiful.
okay, are you doing okay, Alex?
Yeah.
Okay. What I'm checking for here is the fluidity of the spine and the ribs. And we should get a nice fluid movement with no block in that movement. Same thing with front to back. I'm doing the same thing. Fluidity of movement.
Nice.
Okay, so again, we're back here. Neutral pelvis. Right side has now sat down. And we're gonna check the heels. And they should be balanced, which they are.
There we go.
Wonderful. You are all set. You can walk around and see how your body is feeling. Oftentimes, your body is imbalanced, but your body has adapted to that, so you just walk and you feel balanced. But now, oftentimes, after an adjustment, patients feel off balance,
Yeah.
but in fact, they are in balance. So
Yeah, the
the
brain-
nervous system now has to recalibrate and adjust to its new form.
We work in the opposite way in that sense. Since I'm fixing the imbalance in the brain at first, and the body follow, and you fix the body so the brain can follow. But
Yes.
all the road come to Rome. you know?
Yeah.
You
We're
can-
getting to
thank
the
you-
same
thank you, Dr. Vic.
destination.
I will be curious to have a look in our walk pattern on the beautiful line you got on the other way here of the clinic. So we can just check out the movement, the sacroiliac movement, if you want. If it's a proper movement now, walking instead of just lying on the.
Yes.
Yeah, cool.
Well, we can check the functional movement
Perfect.
for sure.
Okay, so I put 2 dots just over the sacroiliac joint here. We're gonna see how they move. We got a great line here. So Alex, just walk straight like nobody's watching you. See all the rotation. She walk in rotation. You see that that's what's going on? Look the hip. Left hip got more rotation. Okay, it's more coming from in front of us. Continue. Check out the dots. So the right hip don't move as much as the left hip. You can see it. So with those dots, we can really focus on the right thing. Okay. So after, if we go down, continue. You're gonna see that her right foot is going in valgus. It's going internal like that. Continue. So if the right foot go, you see what's going on?
Yeah.
So the hip's gonna shift, so the other one's gonna try to readjust. So where's the real problem actually? Real problem might be the
Oh,
right
you're
foot.
Really like this.
Okay, find something with the left inversion of the foot is not properly done. So we just create a stimulus to the brain at the moment, and we're gonna recheck the walk right now. Okay, so we'll try to walk. You see?
Yeah.
That's a different world, huh?
Also, it seems like the right glute is engaging more.
Look the feet, not even dropping. Continue.
I'm on and then we'll
Really
be back.
less rotation. Continue.
Yeah, that's crazy.
So that's a good job. One exercise. We changed the entire biomechanic. So we're gonna check the posture. People didn't see anything. I'm gonna let you hold the camera. Beautiful. How you feel?
Better.
Feel different, huh? Yeah. Hold it, please. Now just do a quick check here. Relax. Look. Oh. 0.5.
Yes.
Relax. Ear is fixed. One stimulus. Ankle inversion. Crazy, huh? So that's it. Okay, hi guys. I hope you enjoyed the video. We did some great show up with Dr. Vic here
this is
for a
great.
pregnant woman. Because some people are concerned about the danger of adjustment and stuff like that. the professionals know what to do properly. They learn it in school. That's a doctorate. That's not something they
I
learn.
got my degree on the internet, by the way.
It's not something they learn on the spot in a 2-day seminar. Those are great specialists here. At Apollo, we got physiotherapists, acupuncturists, massage therapists, chiropractors. Now we got Me Too's and neurotherapists.
Yes.
So I'm basically the link, the guy that tried to learn everything a bit and understand to who refer after, to who's going to do
He's
the best
amazing.
job. Thank you.
Just gotta say,
So
first-hand experience.
yeah. So we did an adjustment. We saw with Alexandra lying on the belly. The posture was fixed like that, but in a standing way. Since she got issues with her feet, eyes, and some maybe motor pattern, her gait pattern was off. So we made her walk, and we see that the problem was still like that. So maybe sometimes the adjustment or whatever, we need to fix the brain in all in complete matter of regard of how the body interact with reality. So
Well, over a period of time, the body gets into its protective state because it is not in its optimal function, and in that protected state, our treatments are effective, but not nearly as effective as if we were to disengage the nervous system in terms of its protected state and allowing for more room. How I explain it to my patients is that the body and the fascia, which covers the body, is like an envelope. Encasing the whole body. And when the nervous system is not in its optimal function, that will tighten up and not allow for proper movement of muscles and joints, especially the spine in the body, and not just the spine, but the lower limbs and the upper limbs. In its functioning state, it'll prevent it from functioning to an optimal state. So in collaboration and working on the nervous system in getting it to its neutral state by balancing the balance centers by the eyes, by the feet, then we can allow for more of an effective adjustment or physiotherapy techniques or massage therapy, muscle techniques.
everyone is useful in the chain, in fact.
100%.
So I'm testing stimulus on the body and see if it affects the posture, if it affects the movement. So if we fix the gait as well, we know that the person has got a treatment or in the whatever methodology they use, because everything is good actually. If the person walk around and the gait pattern is not proper after the person is going to go back faster in an imbalanced mode, since the gait reflect all the junk in the body, everything's moved. So I think that's a great trick that Dr. Vic can integrate in his practice as well, to create some stimulus over the feet, over the stuff like that, and the adjustment will last way longer than.
It has changed my practice. I've got to say, I've just been seeing some amazing things in incorporating this into my practice. And I mean, this is truly a collaborative center where we all work together, because patients come number one and patient care is number one. So I mean, at the end of the day, when patients are coming in here, they should be getting value for what they're paying for, and getting the utmost service as to what they're coming in for. And we have a collaborative team now of therapists where we really work together and helping out the patient the best we can.
I can add, don't wait to be injured. Come see a specialist in your health, because the box of movement, like Dr. Vic was saying, if you start to move awkwardly, feel some restriction, you're already in compensation mode, and your body can compensate all the. For eternity, it's just going worse and going worse.
There's an old saying, an ounce of prevention is worth a pound of cure.
Wow.
It's always easier to prevent something or a problem from getting worse than when it is present, when it's there in its inflammatory state or at its worst state. Then it becomes a lot harder to, not that it cannot be fixed, but it may be more challenging, or we don't want to wait to a point where there's no return.
Well, it's way more costlier, and if some people wait for a surgery most of the time, when most of people going to surgery don't need a surgery. They need a proper adjustment before everything break apart. And we're human being. We're living tissues all the time, and our cells are constantly changing themselves. So you can heal yourself, you can heal your body, your self-preservation system with a great homeostasis.
I mean, we're made perfect to a certain degree, so I mean...
well, you maybe, that working process.
I'm just saying, as a baby, we may be made perfect, but then we get screwed up along the way. Yeah. And so it's our duty to self and to others to help each other along the journey to get that body back to its optimal state of function, so we can live long and healthy.
Yeah, thank you a lot. It was fun. See you on other video. Please share. Please subscribe to a page, Apollo Physical Therapy Center page, and the Institute Neuro Performance page. Everything is getting translated now, French and English. So bring some peeps around. Let's share some love and some help. And
let's live life to the fullest.
And we wait you for the next video. See ya.
Take care.